We we have a lot to cover today, and I think our time has just been kind of eaten away a little bit. So welcome everybody, and my name is Sue Grinnell, and I am the director of the Population Health Innovation Lab. Next slide. So today we are very excited to host a provocative conversation, the intersection of for-profit business and public health. So welcome. And we are going to be recording. The slides and the recording will be available after today on our website. So you can refer back. And as I said, I am the director of the Population Health Innovation Lab. We are a program of the Public Health Institute, and we design, catalyze, and accelerate innovative approaches that advance health, well-being, and equity. Next slide. And we're excited because this is actually our 5th and last scheduled Fill Up Your Cup. This was an idea that we had last year, really springing from the fact that we know people are isolated. We know they want to be in conversation. So we thought, let's host some conversations. And we have had to date 5, and this is our 5th, 376 participants that have registered and joined, and 34 states, which is pretty amazing, that have come and joined us, and 3 different countries. So welcome. And when we do the registrations, we always ask poll questions, right? Just to kind of get a sense of where people are at. And for today's topic, we thought it would be really interesting to share some of what you said, right? And just looking at what are the pros of engaging with for-profit organizations to do public health work. I think people are really interested always in efficiencies, access to resources, flexible approaches, new perspectives, and the ability to scale. I think looking at the challenges, there was across the board these themes of misaligned incentives, thinking that structural and cultural differences, and just this notion of wanting to get a quick return when recognizing a lot of the work that we all do takes a long time to do that. So we thought it would be helpful to share as we're diving in. And for today, really, like, our intention was to bring people together who are doing really hard work of supporting multi-sector collaboratives to discuss shared challenges, brainstorm ideas, and share resources. And so welcome. We have framed these in such a way that we always have a concept and a resource. And today's concept is this notion of analogous inspiration. So we're going to explain what that is. And we have some resources that we'll share with you about what that practice is and how you might do it. We're going to be hearing from Julie Lawrence, who's the CEO of Eviset. And really, it's kind of very much in keeping with this theme of analogous inspiration. And we had hoped to do some breakout groups because we have 2 different things that we wanted to dive into, and just do a poll in closing. So diving into this notion of analogous inspiration, I think I can just speak for myself. I've been doing public health for a very long time. And I think we all kind of get into ruts of like, oh, I'm doing this. I've always done it this way. And just thinking about how it might be really useful to consider doing things with a new approach, a new perspective, and getting unstuck to be able to do that. So analogous inspiration, I'd love to hear, for those of you that are here, is this a term that any of you have used or that you're familiar with? Love to just see in the chat, but it can be a really valuable approach for problem solving and innovation. Next slide. And really the concept of analogous inspiration, really it's the process of drawing inspiration and ideas from fields that are not your own, right? So if you're used to if you're in public health, for example, and you always go to public health resources, you may always be getting some of the same ideas. But this is this notion where you actually look at what's the problem you're trying to solve, and maybe look to a business, to some concept, just different places where you could actually go and research how do they actually do it? How are they approaching that? Next slide. So this is just kind of a kind of quick and, just of what it really is. So just thinking about a problem, right, that you're trying to solve. We are working on something right now, where we want to create a rural innovation hub. So we're thinking, like yesterday we met and it's like, well, what's the problem we're trying to solve? We want to really understand what that is. So we've decided we're going to do some research, right, and looking to other places where they might do something similar. And so you go find those and actually create an interview guide. You might do some reading, you might talk to people, you might visit them if you can do that. And really the point is to gain key insights or strategies, right, or methods to take it. It's not going to maybe be exactly the same, but it's like, wow, they're doing this. How might I apply that or adapt it to my work? Next slide. So here's kind of a couple of examples that we just thought might be helpful, right? Hospital emergency rooms have been known, not certainly in all cases, but been inspired by F1 pit stop crews. You see the cars that come in, they go really fast, they're changing tires. So just looking at how are they actually doing their work. Henry Ford was actually inspired by systems within slaughterhouses to create the assembly lines. And executives like writers, other creative, professionals actually use a lot of analogies for empathizing with audiences and communicating and sparking ideas. So those are kind of some examples of, what is analogous inspiration. And I think Katie put some tools in there that can help you to do that. And we're very excited today because Julie actually came to one of our sessions and I think registered, and she was very interested in the stigma, right, related to for-profit and not-profit. And we thought this would be awesome. This is a perfect example that we wanted to dive into of analogous inspiration. So I think, Julie, if you want to go ahead and share your slides.
I just requested co-host access.
Okay.
If I could.
Oh, because we're in a new.
Yeah.
Very good. But while we're doing that, I think probably Katie, if you want to take down the slides, great. Let me introduce Julie. Excuse me. So Julie Lawrence is the CEO and co-founder at Eviset. And they are the leading provider of business intelligence on key performance indicators for social care providers. She has deep expertise in leveraging data and patient experience to improve health practice across medical and social care. She's trained as an MBA at the Wharton School and is a fellow at Stanford's Clinical Excellence Research Center. And she has a passion for how for-profit market incentives can be a force for good in healthcare and drive rapid scaling of improvements in healthcare quality and cost. She currently serves as on the National Partnership to Align Social Care Work Group, startup advisor at UC Berkeley's Skydeck Accelerator, a board member of Wharton Alumni Angel Investors, and is an affiliated scholar at Stanford's Clinical Excellence Research Center. And with that, I'm very grateful for you being here with us today, Julie, and I'm going to turn it over to you.
Thank you, Sue. I am very grateful to be here, and I really appreciate the invitation. And really just want to start by commending you and the Phil team for this really cool multi-sector format. I'm looking forward to not only, sharing some thoughts today, but definitely hearing back from the other folks in the room. So I hope we'll use the chat throughout. Um, and with that, we'll just start. As Sue said, I'm Julie Lawrence, CEO and co-founder of Eviset, and we are a for-profit company in public health. So I know with public health folks in the room, one of the things we all share in common is that we're all mission driven. And I thought I might start out by sharing my career mission with this group, which is to improve health for people. And my specific recipe of it is through optimal deployment of innovation and resources. So you can see a lot of logos here. They're representative of different sectors. We have for-profit, not-for-profit, academia, foundation, startups. These are all organizations where in some capacity I have served either as an employee, an advisor, an investor, or a board member. And I put these logos here really to try to make the point that the missions like we have in public health can be achieved in any sector. I truly believe that public health is so important that we really want to leverage the best of all sectors. So whichever sector you're here from today, driving towards public health improvement, thank you for your work. And I hope we'll be able to learn from each other's diverse perspectives. So we have one poll that's going to go up here, if we can get that launched. And I'm going to take it off my screen because I know the answers, but if you would be kind enough to answer, and then we'll see what the results are in a moment. While we do that, I wanted to give some brief context on what we do at Eviset. And Sue shared a little bit about this at the beginning, but in a word, what we have developed is a robust data-driven platform that offers unprecedented visibility deep into the social care sector, specifically looking at social care providers. So why do we do this? Well, many of you in the room probably know this already, that 80% of health is actually driven by social determinants of health. These are things like having access to enough healthy, nutritious food, stable transportation, reliable housing. If you unpack that, what we find is that we have a sector of 250,000 fragmented organizations that annually provide about $200 billion of services. And during COVID, we all saw that these services were in very acute demand, and the spotlight was cast on just how important the social care sector is for public health. So at that time, I was serving as entrepreneur in residence at Healthy Alliance, which is a very large network of social care providers, hundreds and hundreds of care providers under one umbrella. And my now co-founder of Eviset, Dr. Venus Wong, was doing postdoctoral research work at Stanford in this sector. And many wonderful things about Venus, but one thing you should know is that if a data set exists, Venus will find it. So knowing that about her, when she called me and said she couldn't find any high quality data sets on things like capacity or care quality or financial sustainability, client experience for social care providers, it really got my attention. So when we started this company, we asked the question, what do we need to know in public health about social care providers to really prepare for the tsunami of both public and private dollars that are pouring into the sector? So this would be a time for us to share the poll results if they've come in, because our question to you was, where do you come out on this? And just looking here, I can see that in terms of gathering information on nonprofit social care providers, the vast majority of you said not confident or somewhat confident, but there weren't very many confidence or very confident in your ability to find this data. Interestingly, the sense is that finding out this information on for-profit social care providers is a bit higher. So that's interesting. But needless to say, we'd love for those numbers to be up much higher. We'd like everybody to feel really comfortable about the decisions they're making, whether they're looking for partners or collaborators. So with that in mind, we decided to launch Eviset to improve the sector's understanding so that everyone can make great decisions on behalf of the patients and community members that they're responsible for. I want to just speak briefly about two reasons we specifically chose to form Eviset as a for-profit company. And I saw in some of the comments that folks provided when they registered that these themes do seem to resonate. So people do tend to associate these with the for-profit sector, and they were very real for us. So the first thing is we knew that the social care sector after COVID is transforming very quickly. We needed to be able to move fast to meet it and to stay relevant. And for us, that meant we needed for-profit company capital raising ability. And that was critical. The second is we were deeply committed that this important work would be sustainable. So 10 years from now, this work will still be thriving and still be of use to the sector. And unfortunately, we've probably all had this experience of great data projects in public health that die after 2 or 3 years because they don't have sustainable funding. So we didn't want that to happen. And what we see is that, us coming into the sector as a for-profit company is not entirely an anomaly. What we are seeing in public health in general is that there's a lot of change because for-profit companies are getting into traditionally nonprofit spaces. So here's an example that is near and dear to us from our work in California. CalAIM, for those of you who don't know, is a statewide initiative to transform the Medicaid system in California. And it specifically calls on managed care plans to contract for enhanced care management and community support services. So these are services where community-based nonprofits have historically thrived. But here's what we observed. More than half of the plans have opted to contract with national for-profit companies. So, just reporting, that's what the data is showing us. Objectively, that's what's happening. So, what I want to invite us to do is to look at that through the lens of analogous inspiration. What might these for-profit companies that are emerging to some success here, what might they have to offer? And what could we learn from that that could help improve for all? We highlighted two of the factors here that seem to jump to the top: access to large pools of capital and benefits from economies of scale. And you can probably see why those things could be helpful in standing up new operations and infrastructure investment that's needed to meet this demand for social care contracting as it grows exponentially. So, analogous inspiration would have us ask, what can the social care sector writ large learn from the successes here of the for-profits in the space? And some of the most progressive nonprofits are doing just this. They are really growing and learning and building new capabilities. It's something we see on a daily basis. At Eviset, we are actually engaged by the California State Department of Healthcare Services to provide technical assistance to social care providers as part of CalAIM. And I want to say, bravo to the nonprofit social care providers who are doing that work because public health needs them. We need this sector to be strong because they are a primary source of social determinants of health supports in communities across the United States. But as we meet them right now, the financial picture is challenging, right? Sustainability is a challenge, investing in infrastructure is a challenge. So there's a ripe opportunity here to deploy new ideas, bring new innovations, look to adjacent possible places where those problems are present and see what we can learn. So recommending analogous inspiration as a great tool for this sector. And we are quickly making our way now to the interactive portion of the day and preparing to go to breakout sessions. So I'm going to share two case examples from the social care sector. And they're going to form the basis of our breakout rooms, and you'll be able to select which one you want to go to. So this is the first one of two. This is a case example of an organization that is getting amazing results. They are helping to address food insecurity through home delivery of meals. So if you can't get to the food pantry because of logistics or health, they bring it to you. Anybody have any guesses who this is? And I'm going to ask you to pop them into the chat or just chime out with them. And on my screen view, I can't see that. So I'll ask perhaps Katie to tell me if do we have any good guesses in the chat. Anything in there, Katie? Anybody got a guess?
Not yet. Maybe.
All right. Well, I'm going to just reveal them. And I'm going to ask for people to tell me if they think they're surprised.
Oh, we have one, Meals on Wheels.
Good guess. And when I run this slide with my staff, that was their guess as well. So it's a great one. But are you surprised to know that this is DoorDash? And you can find this on their website. So this is an example of a non-traditional player from the for-profit sector that is playing an important role in the social care sector. I'm going to show one more example, and it's going to be a little easier to guess this time. So think along the same lines. I'm going to cue it up. I hope we're going to have a winner here, right? We're looking at non-emergency medical transportation. Also incredibly important, right? These are things like rides for patients who get discharged from the hospital, need to go home, don't have a ride, or don't have reliable transportation and need special assistance to get to routine doctor's appointments or to go pick up medications. Does anybody have a guess who this is? Do we have any good ones in the chat?
We have Uber.
Okay, well, see, you got that one. So it's Uber and it's Lyft. And if you notice, they've even branded themselves now for this part of their business as healthcare. So this is really new. And I think it's an example of how important this sector is and the opportunities to meet patient needs in new ways. We're going to open up the breakout rooms in just a moment here, and you get to self-select into the room of your choosing. And here's what I'm going to invite us all to do. There's a couple of questions that the facilitators in the breakout rooms will have. But, we're just going to start with what surprises you about, DoorDash or Uber getting into the space. And then let's look objectively at the sort of pros and cons. What are some of the most compelling benefits that we could see from them? What are some of the risks and concerns we might have? And then looking at this analogous inspiration that we see from them, what can we take away? What could the sector learn from them? And if we have time, it'd be great to hear from you and your organizations. Are there any for-profits that you could look to say, they do that thing well? Or if you're in a for-profit, look at a nonprofit. They do that thing well. What can we learn from them through analogous inspiration? So I am done with my section here. I know we need to move into the breakouts, and I'm going to let you take over, Katie, and tell us how to do that.
Just any brief reflections from our group? I don't know if you heard. I know Lisa was also expressing she is newly with Partnership Health Plan. Lisa, do you want to just briefly mention any reflections from the discussion?
Yeah, it's an interesting concept. I, again, question Uber's motives, but I do feel that, because they kind of have this well-oiled machine already in place, they have apps already out there to order services where, a lot of our EMRs are not, or the emergency providers. So I have quickly, so I did Lyft. I was a Lyft driver just for fun one time. And one of our things is we would pick people up for hospitals, but there wasn't like this follow-up. It's just like the hospital would order a Lyft to come pick somebody up who didn't have a ride, but yet did they make it home? Did they, I mean, there wasn't like this aftercare. So I think that that part needs to be looked at in terms of you have a non-medical person delivering somebody and providing a ride, but yet what happens after they're dropped off after they've received care? I don't know. So just throwing that out there.
Lisa, there's some great articles on that, and in the tiny font at the bottom of my slide is actually a link to a couple of them.
Oh, great.
That's a
Great.
real issue that is coming up. So, to me, this just also says, there's a lot of work that needs to be done on tough problems like this. So everybody can learn from everybody, right? It's not that there's a perfect solution. So there's some benefits of the Uber that you've mentioned, the efficiency, and then there's some challenges, right? So I think the
Yeah.
hope is that we iterate and get better, and to get better faster from
Yeah. Well, I
learning
think
quickly.
Uber's positioned to do that. So to get better faster, so it's just working out some of these, logistical things. But good to know. This was an interesting conversation and topic. I was glad I joined. I didn't know if I would have time or not. So
Great, thank you so much. Well, we are at time. This was pretty amazing. I think we have a short poll for you. And as I said when we started, this is our 5th and last scheduled Fill Up Your Cup. I think, as I also said earlier, this was an experiment, and we'd love to hear from those of you if you think we should keep going. If you think, I'm also wondering, Julie, I know this might be putting you on the spot, like, this is such a great topic, and with the Zoom link thing, should we think about doing it again or somehow promoting it? Because I just think it's such a provocative topic, and I think there's so much to be discussed. So anyway, we can, just a thought. Yeah, but yeah, love for you to just take a moment to and then anything to share in the chat or just verbally, would love to hear from you all. What about Kyle, do you want to speak this?
Sure, I can. Yeah, I think looking at doing multi-sector collaborative work, in particular at the hyper-local level, like neighborhoods, for example, around public health, and engaging for-profit local companies. So what are, some of your experiences around looking at shared values behind motivations, possibly beyond just the generic corporate social responsibility movement? Just looking for some feedback, insight, example.
Mm-hmm. So would you think it'd be a great topic to have further discussion?
Yeah, and or if anybody today wanted to chime in, if there's time.
Mm-hmm. I don't know, Julie, if you have any thoughts on that or.
So the question is about, sorry, Kaiser, was it Kaiser, did you say?
My name's Kyle.
Kyle, sorry, about for-profit companies and sort of, sorry, can you just repeat it for me, please? I just want to make sure I get to the essence of it, because my mind went in a lot of different places, and I want to make sure I'm answering what you want to know.
Mm-hmm.
Just your experience in exploring their motivations and getting involved in multi-sector collaborative work for public health.
Yeah, and I think maybe that's why my mind went in a lot of different directions, because I think there are multiple answers to that. And I think it depends on the organization. There certainly is a, all corporations want to look good in the public eye, and meeting public sentiment that, whether it's being, more environmentally conscious or more community conscious or more, racially conscious. I mean, there's a million ways that they try to signal that. So that's certainly there, right? But I have, certainly seen that there's some very, very legitimate goals in addressing real health needs. And I'll just give an example, since we work a lot, at the intersection of social care and health plans, right? Health plans have an incentive for their members to be healthy. That is a financial and business incentive for them, right? But it's also, it can go well in hand with a human impact incentive. So I think, I guess I'm saying, I'm giving you two short examples. It's a really complex question. I think it depends on the organization, some types of organization based on where they work, you know, where they fit structurally into the sector, like the example I just gave for health plans. You know, it's not as hard to align the profit motive and the public health motive, right? Others, you have to look underneath the veneer and see what else is there. So I guess I don't have a simple answer, but I think that was the point of today's conversation, was to look constructively and objectively at things that organizations bring, and look constructively and objectively about some risks, and make responsible decisions, you know?
Yeah, I think that's really helpful, Julie, and just thinking about what are the types of questions or whatever, how you can actually get to what Kyle is saying seems really important, rather than maybe just saying, oh, I'm not going to engage with them because of a stigma. I think that's where maybe there's more to it, right? So I think it's a great question. So
thank you, Kyle.
yeah, thank you so much. Okay, we are over. I think I will just, you know, Katie, if you want to just take 1 minute, we'll put up our, just to kind of do a little, I guess a kind of promotion here for, we have put together a curriculum that is available. We can do training on this, and it's all about multi-sector collaboratives and the really, really hard work. So I just want to promote that, and it has 11 modules that are in it, with each module having 1 to 2 lessons. This topic actually is not in there, right, in terms of engaging. So I think we currently are in the process of figuring out, because as we know, the world changes, where should we make some updates to this work? But just want to promote that. So thank you so much, and appreciate your time. Great. Thanks, Megan.